Hi everyone, Martyn here, and welcome back to a very special episode of Just a Sharp Scratch. Now, things are going to sound a little bit different today because I'm not doing the interviewing. The first time ever, I'm handing over the reins. This episode is a full podcast takeover, hosted by someone who's not only been a brilliant guest in the past, but someone I really respect as a storyteller and advocate for frontline care, Peter Murphy-Lewis. Peter's going to be interviewing me, which feels a bit weird, to be honest, but we thought it was time to kind of share a bit more about the journey behind the podcast, the projects I'm working on, and why this platform exists in the first place. So for this one-off Just a Sharp Scratch special, I'll be the guest, Peter will be in charge, and anything could happen. Let's get into it.
Welcome to a special episode of Just a Sharp Scratch, where the roles today are reversed. I'm Peter Murphy-Lewis. I don't have the normal accent that you've heard before. I'm the founder of Strategic Pete and host of a documentary in the healthcare space called People Worth Caring About. But today, I'm not the most important person in the room. It's your favorite host. Yeah, you know who he is. His name is Martyn Davey, and I have the privilege to interview him about his podcast, about nursing associates, and the amazing work that he is doing at the national level for listeners like yourself. You know him. He's spent years advocating and supporting these roles. But today we get to dive in a little bit deeper, put the microphone on him, and highlight what's special about Martyn Davey. Martyn, welcome to the program, your program.
No, well, thank you ever so much for agreeing to be the host. This feels so bizarre to me to hand over the reins, but I'm so honored the fact that you're able to do this for me.
Martyn, I want to start off with a podcast question. What is a way that you make your guests feel comfortable? I've heard enough of your episodes that you are special. You have a talent. How would you describe that? If you were going to teach, a child or a high schooler what you've learned, what is that?
I think probably not to take yourself too seriously, to kind of find the fun within how you can ask those questions and stuff like that, and try to just be open and honest, really. I think being able to have those icebreaker questions right at the beginning has been a way to make everyone relaxed, including myself, because I really needed to right at the beginning. I listened back now to the first kind of episodes we did, and there's lots of ums and kind of gaps and stuff, but I think especially having those funny icebreaker questions and you don't know what you're going to get is a great way to kind of being able to kind of start that show off.
You're a storyteller at this point. Have you always considered yourself a storyteller? And at what point would you say, I realize I love this medium. I love the way of finding people's passion and telling a story that resonates with others?
I think at the beginning, I really like talking. I think lots of people could probably say that about me. I have ADHD, and that's probably one of the parts as well. And for me, having this voice, being able to kind of talk about this role that's in this healthcare industry was really, really important. But it wasn't about just my voice. I think that's what really kind of resonated with me, was the fact that there are thousands of nursing associates out there that have this voice, have this story of being able to tell them what they've done and how they've achieved it. Because, like I said, with this course, it's not a Mickey Mouse course. It's something that's kind of really takes a long time to get through. There's 2 years of hard work. And lots of people who are kind of wanting to be able to progress in their career and, have gone through such hardships in order to get there. There's many of us who this will be the first time, in their family members of going to university. So, to hear these stories of how passionate they are about healthcare and for their patients and just being able to support the nursing team is something I really, really wanted to be able to do.
Where do you attribute your interest in giving other people a voice? I don't think that, the average citizen, human, thinks about paying it forward like you do by giving people who don't have a voice, giving people a microphone. Where did you get that?
I think it really came down to where I used to work in mental health. That was my kind of forte. And I've always had this kind of approach to being able to listen to people, to hear their stories and stuff like that. And, one of the things I remember when I first joined the healthcare system, there was this amazing nurse, and she was talking to me about Florence Nightingale and about how she said that, at the end of the day, our hospitals are like hotels and the patients are our guests. And that's how you should be treating them. And being able to sometimes, being on shift and seeing these parents that have kind of been waiting in A&E or ER, if it's in America, emergency rooms for a very long time and not having had anything to eat or drink, and just being able to kind of, when they come onto the ward, say, look, do you want a cup of tea and a biscuit? Being able to kind of comfort them and say, look, you're here now, we're here to look after you and look after your loved one. Being able to have that voice and stuff, I think that's where that caring side came from. I think it just kind of came naturally. And I think, I started off working in a supermarket and stacking shelves, and I remember this manager telling me that I was always going to be a shelf stacker. That's how he said to me. And I was like, well, I'm 18 at the time. And I thought, no, I don't want to do this. And I ended up needing to find a job. And I think that's when I stumbled into care. And for me, it's because it was a job that was available straight away. I needed it because I needed money. But then being kind of paid to just be yourself. It wasn't a hard job in that sense. Yes, it was physically hard and sometimes mentally hard, but just being yourself and just asking and having a chat with someone and spending that time with them and making even something so small made such a difference to them, made me feel that this is where I needed to be. This is where I needed to stay.
Martyn, about 10 or 15 years ago, I realized that the closer that I am to my own awareness of mortality, the more grounded I feel as a human. And that's helped me a lot with, my own depression and mental health struggles. What attracted you to mental health and what's your personal story that you're still here helping people?
For me, I started off in physical care. So general care, working in the hospital. With that, you were able to kind of see the process quickly of how someone gets better. And, there were patients that were coming on with mental health problems. There were lots of people that would shy away from them because they hadn't got time and stuff like that. And it really upset me, the fact that, they were being kind of almost stamped as though, then it was just a waste of time. There's no point. So when the opportunity came for me to go and work, especially in the CAMS, which is the Child and Adolescent Mental Health Services, so teenagers from 13 to 18, basically, I wanted to go and be able to spend that time with them and to see how it goes. And what the struggle I found right at the beginning was having to change my mentality and how I look at these patients. Because before, you have, like I say, with a break, you could see that it's broken, you saw the x-ray, you knew that you would put a plaster cast on it. 6 weeks later, you're having physio, it's all going to be well. But with mental health patients, there's a point where you have to step back and allow them their journey. And sometimes that journey can be really detrimental. It really kind of upsets you, thinking, actually, I just want to jump in and save them. A great analogy that I had when I thought about it was just like, in life, we're constantly always building a house. So we have this foundation level, and everyone's foundation level is different. It's not all the same. But when you're born, you start building your house, your own house, start creating it. You start learning how to walk, how to talk. And this is when you're starting to build your house. And then through life, you're learning things. Things happen to you, like financial issues, going to school, getting bullied, all this kind of stuff. And you break bits of your house, but you learn that resilience. You learn those skills to be able to fix it. And sometimes, you break your house so much that you then kind of come to need that support. And this is where we give you these tools and stuff like that to be able to help. So anxiety tools, self-harm tools, all those kind of stuff to be able to fix those problems. So if it ever happened again, you can fix your house, because at the moment you didn't realize what you need to do. But sometimes you have these patients that you have to watch them break their house so much that they end up going back to that foundation level. And it can be really, really tough to watch that happen. But sometimes they need to do that in order to make their house stronger again. And I think that's that point where I realized that how powerful, mental health and stuff, and nurses and stuff, and the support that's needed, especially in the healthcare industry in the UK for mental health. It gets about, I think, I'm going to quote myself, but it probably is wrong, but it's nearly about 5% of the NHS budget is really a small amount that kind of gets focused on the NHS. I'm sure it's a bit more now, but it's still a very small amount. And there's a lot of time people are waiting for services and stuff. So, yeah.
Martyn, oftentimes the most powerful stories, and you mentioned power, are ones that transform you, and those are hard to forget. Can you think of a story, and obviously you can keep certain facts anonymous, that there's a before and after in your life, and why that impacted you?
I think for me, there was one patient who was basically, yeah, so there's been a couple, but there's one patient who I was doing a blood test just before Christmas. I think it was last year. And I was doing a blood test on this little boy. Well, it's a teenager. I say little boy because I feel old. And the mum was sat down and she said, do you recognize me? And I said, well, kind of looked at them and went, kind of. And she said, well, a year ago, you took my blood and you asked me how I was feeling. And I just said, yeah, okay. And I said, but then you asked me again, how are you? And that was when I opened up and told you about my eating issues that I was having, the disorder and stuff that I was going through, and how, and stuff like that. And I gave her some time. We had a little bit of extra time and support and stuff. And I had to go and see the duty doctor that was on call at that point in time. And she said, if it wasn't for you taking that extra couple of minutes, just having that chat, she had already planned to go and end her life that evening. She had already got her kids to go to someone else. She had already set up everything ready to go. But because I was doing that one blood test and spent that time with her, she turned her life around. She stopped drinking. She'd been clean for about 9 months. And she said, if it wasn't for you, this is the first Christmas that we're having with my son together. And it was like a kind of wow moment. I felt so honored the fact that I'm going to try not to well up, to be able to kind of, to be able to be there at that point in time. And like I said, it's for me, I always sometimes will always ask you that second question, how are you? Don't just do it once, do it twice, because it's always the second time where you get the true answer of how they are truly feeling.
Wow, I love the second time. And it's really special how such ordinary moments that happen every single day can be extraordinary for somebody else. And, she sharing that with you ended up being extraordinary for you. Now, you made me tear up on this Thursday afternoon, and I'm sure some people in the audience will who've connected with you and listened. That's beautiful. Thank you for sharing that. Throughout your career, you've worked hard to bring visibility to roles that often go unnoticed. Nursing associates, for example. From your experience, what is the most important way for you to change the public narrative and make them noticeable?
I think education, that's the biggest part. I think a lot of people still don't know what we can and can't do. And I think also having a real set out guidelines of what nursing associates can and can't do, and that everyone sings from the same hymn sheet, basically. Because we do have this scope of practice, which is quite small, to be honest with you. It's not a big thing compared to LVNs and LPNs that I've seen, and even SENs and stuff in Australia. So there's a lot of work that needs doing in the sense of re-looking at that with fresh eyes, because I think when that scope of practice was created, it was created before COVID, basically, where the world was different then. And, we've changed so much since that awful pandemic. And I think it's now got to the point where it needs to almost be revamped, re-looked at with fresh eyes, that the point where we have lots of individual trusts and hospitals, almost like different counties, will do different roles with it, with the nursing associate role. And it can be very frustrating to the point where sometimes they are kind of overused to the point where they feel forced to do stuff just because they want to be part of the team or accepted, or feel as though they could lose their job if they don't do it, which is obviously really risky and dangerous to patients and less of those themselves. And then you have those that are just not utilized at all and put back into roles that are just not efficient for them. And basically it was pointless in doing that 2-year program. So I think education and being able to kind of, like I said, to look at resetting that role and re-looking at it and evaluating the future for nursing associates.
Martyn, you have multiple platforms in giving these unnoticed individuals more visibility, but I'm sure you didn't start off as a pro. What was your media journey? How did you figure out what you are today and where you're going?
Well, it all started with a Facebook group. I think, basically back in 2017 when I was the first kind of pilot guinea pigs of nursing associate roles. I had to, I kind of asked to become a national rep for our cohort. So my little university, each university at that point in time were kind of doing their own different things. So one person had to go down to London every so many months and speak to the big organizations there that were running the nursing associate program. It very much felt that we were kind of, like I said, all going in different directions. There wasn't enough information. So I created this Facebook team group for nursing associates, and we had about 35 people join. But now we have over 6,500 nursing associates on there. You know, it's become a platform of peer support. That's what it was aimed for, and still contributes to be so today, which is fantastic. And I think then eventually, I remember listening to a gentleman on a podcast who came from Australia, and he was a comedian, very, 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 very funny. And sadly, one time he said he's not doing any podcasts anymore. He couldn't afford to do it. Also, the funding and stuff had gone. And I was like, oh no, what do I do? You know, I've been listening to these at night time to help me fall asleep. So I thought I'd search for nursing associate podcasts, and I found none. Absolutely none. There was nothing about nursing associates, maybe the odd 20-minute snippet that someone's talking about them, but there was nothing specifically for that platform to talk about and raise that profile. And that's where it kind of came from, because I thought to myself, how hard can a podcast be? I was completely wrong. But I had some good friends who were happy to become guests, you know, and stuff like that, and happy for me to interrogate them. And it's kind of grown from there. And then the ideas of being able to have the other platforms like the Extra Dose, where it allows me to talk to other healthcare professionals around the world, allows me to talk to yourself, you know, and things like that, to be able to have that, because, you know, we wouldn't have met without it, to then being able to grow the YouTube channel, the documentaries and stuff that's coming out. And it's something that I've couldn't believe has grown so much. And I generally thought I'd be cancelled after the first couple of episodes, to be honest with you. I didn't think people would embrace it as much as they have. And I don't do this for fame. It's nothing like that. I don't even do it for financial gain. There is no Lamborghini sat outside. I can definitely tell you that. I may have a couple of Hot Wheel cars, but that's about it. But for me, it's like I said, being able to get those voices out and to educate people. You know, I'm really passionate about this role. It's not here to replace nurses. We are not cheap nurses. We are here to, like I said, to be able to support, look after those patients, and to stop nurses from burning out. You know, we have a massive crisis here, and I think it's in every country, to be honest with you. It's no different, of shortages of nurses, you know, and nursing jobs. So we just want to be able to kind of make sure that the NHS stays the way it is. It's a fantastic organisation, and without it, you know, I don't know what would happen. You know, it scares me to think about the fact that, you know, when you think of other countries that don't have this resource that we have, and I think that's why we have to make sure we protect it and grasp it and really look after it.
Do you, after all of these interviews, hours, hundreds of hours on film, do you ever get nervous? Do you ever have imposter syndrome once in a while?
Every single podcast, even now, even before kind of setting up with you today and thinking about it, I got to the point, I think there must have been twice when I thought, you know, I should cancel it. No, it's okay. I don't think I can go through it. And even there's been times, I think, even when I've wanted to give up and think, oh, I don't want to do this no more. But when I have that chat, when I sit down and talk and look at them through, you know, the webcam and stuff like that, and hear their story, it gives me such passion and such an ignition that I go out, I finish the podcast, and I literally run to my wife and go, that was amazing. That was brilliant. I loved it. And I can't wait to get the editing done. I can't wait to get everyone to listen to it. And I think without having guests on, without people reaching out to me like yourself and stuff like that, I think I probably would have given up. I think I would if there was no one out there that thought, you know, I really have a story to tell. I think it would just end, and it's without my listeners and stuff like that, you know, being amazing that they are. Yeah, I think it would have crumbled years ago. So I'm glad that I love you all. Thank you so much for supporting and stuff. And I know even yourself, thank you for being a guest and sharing your story.
I do enough trade shows and take my podcast equipment to enough conventions. I know that the question that listeners ask me, they probably want to ask you and might not have the opportunity. And the question is, I love your podcast. How can I support you? How would you answer that to one of your listeners who hasn't had the guts to ask you?
I think sharing it, talking about it, leaving a comment, even just saying hello, really does make a difference to myself. It makes me know that you are listening, you are there. It's not a random bot that's just deciding to follow me. And I think even if it's just those little things do inspire me to keep going. I try to comment back as much as possible. I try to help as much as possible as I can. And yeah, I think to have that support, just to know that there's someone there that is listening is worth all the gold in tea in China.
What's next? What's JAS Media? What's Crown Fellowships? What's coming up in 2026?
So for us, it's a massive, massive step forward. Something I didn't ever think would ever happen. We launched a kind of our company last year. We kind of became very much like a sole trader, so it's a very small enterprise. But we've now become Just a Sharp Scratch Media Limited, which are kind of like an umbrella company, which will kind of pick up all the other platforms that we have. So the YouTube channel, both the podcasts as well. And it means that we can probably look at getting some funding. That's what we're going to plan to do some amazing projects. One of them would be to look at doing a documentary with a student nursing associate abroad. So maybe looking at coming to America or potentially coming to Australia to kind of shadow shift and to follow the LVNs and CNs and SENs and all that kind of stuff, just to kind of see what the differences and the similarities of the roles and stuff like that, to be able to kind of cross over and maybe even get some of them over here as well to kind of see how it works, a bit like a work experience for both worlds. But obviously then it obviously allows us to kind of, like I said, to do stuff more with the podcast, maybe go on the road a bit more and kind of meet up with these individuals and do live podcasts and things like that. But one of the things I'm very, very proud of, and it's going to take some time to do, is something called the Crown Fellowship. And this is a CIC company, it's a community of interest company, which is basically where it's going to be almost charity based. We're going to get some funding to look at creating leadership programs for nursing associates, because there isn't really anything out there for nursing associates to do regarding leadership. I know people may kind of scream and shout that says our scope of practice says that we can't lead, but there's nothing about nursing associates can't be leaders, in their own right. This, and being able to be that voice for your patient, to be able to kind of support student nurses and stuff like that. This is lots of things that you do as a leader, not just because it says it in your scope of practice. And we find that a lot of those leadership programs are based at nurses because of the funding levels and stuff like that, and people don't really know what we do. So being able to have some support like from the NHS as well, and big organizations that are kind of coming in and helping, is going to be really exciting. It's going to take some time to get it off the ground, because that's the one thing I learned when even with working in the NHS, it does take some time. But the kind of being able to have a model that nursing associates can kind of aim towards, to be part of this alumni, to be part of this Crown Fellowship for nursing associates, I think hopefully will inspire a lot more to stay in their roles and not give up on this role just yet.
I want to dive just a little bit deeper and ask you some rapid fire questions. Are you ready, Martyn?
Oh, yeah, go for it.
All right. What is the first thing that comes to mind when I ask you, what's your proudest professional moment?
Proudest professional moment. I think qualifying as a nursing associate. I think for me, that graduation ceremony, being the first one in my family to break that curse, as we say, and to have, don't get emotional, but to have my eldest son there as well. I think that was a moment that made me go, something to be proud of. And I think for me, this is why I'm doing this Crown Fellowship as well, because it was born out of giving my daughter a bottle at 2:00 in the morning. Like most of my crazy ideas seem to appear with regards of ADHD. And I think that's when this Crown Fellowship came from. And there's a little nod to each of my children in the things that I do. So the Crown Fellowship, the logo that we've created, there's a little raven, and that's what we named our daughter. We named her Raven. So to have these little things, just to kind of, like I said, a little nod to my kids. And I think having this legacy that I want to leave behind, that, even when they get old and have their kids and grandkids to go, when people still talk about the Crown Fellowship, they can say, yeah, my dad did that. I think for me, yeah. So yeah, proud moment.
You may have just answered it, but your proudest personal moment that comes to mind?
A proud personal moment. It's hard because it's one of those things. I think it's also a British thing where we don't like talking about our proudest moment because it makes us feel as though we've got big heads. For me, I think going to places that I didn't think I'd be able to do. So going to 10 Downing Street, to be invited, there was only 5 places and there was about 2,500 nursing associates that could have been chosen at that point in time. And when Sam Donahue chose me, it was a moment. I didn't believe it, to be honest with you. I thought it was a junk email that came through. I think it's a spam or something like that. So I ignored it. But then I thought, the best email Sam. And she said, yeah, sorry, I forgot to tell you, you've been invited. And I was like, okay. And it happened to be on my wedding anniversary when I had to go. So I ended up, obviously my wife said I could go, but I ended up sending her some flowers. And it said on the card I got them to write in the shop, it said, sorry, I'm spending it with another woman, because the Prime Minister at the time was female, called Theresa May. So I kind of thought to myself, cool, they're going to have a bit of a funny moment when they're writing that out, thinking, oh, what an awful husband. But no, going down to 10 Downing Street, I think was a very proud moment. And I don't know if you've seen the film Love Actually. No. So it's a British Christmas film, very kind of big over here. And it has lots of different stories going on in the background, lots of different things that you follow and snippets. And there happens to be this Hugh Grant happens to be the Prime Minister at the time. And he does this really, really funny dance in 10 Downing Street. So you're going to have to find it on YouTube at some point, just because I decided to do that dance at 10 Downing Street. So every time I watch that film, I can say, I did that. Yeah, just because I know I'm probably never get invited back now that I've openly admitted that. But yeah, that's a very proud moment.
Love it. A podcast that you listen to that doesn't have to do anything with what you do in your day-to-day life.
Podcast that I listen to. Well, I've got to admit, I know sounds a bit corny, but I do watch and listen to your stuff. I really do. Just because, I know that doesn't mean because you're here as a guest now, but I do. I've watched all of your documentaries that have come out. And it really inspires me to kind of do the things that you're doing over here, So for me, yeah, it would definitely be kind of, what you're doing on all your episodes and stuff like that.
I appreciate it. When you come stateside, you have a place to stay. Come visit me and meet my family.
Oh, I will keep you. I'll hold you to that.
All right, let's go a little bit deeper. Things that your audience doesn't know about yourself. Tell me a weird quirk about yourself that you do. Maybe you don't step on cracks. Maybe you only wear black. Maybe you only buy a certain type of shoe. Something quirky.
Something quirky. For me, I think I love my Crocs. A form of shoe. I don't know if you must have them in America. You got to, but
yeah, we make fun of them.
I could live in my Crocs. I love them. I could live in them, and I especially love the fact that there's a Batman version that that's out. You can get some Batman Crocs and Ghostbuster Crocs and things like that. So, shout out to Crocs. You never know, they might send me some. But it's things like that. That's the one thing. And my wife, at first, she kind of was like, "Oh, I'm going to have to divorce you. This doesn't seem right." But now I think I've converted her, because obviously when she was pregnant, I said, "Here, put these on," and then it was just like the best thing ever. So I've converted her now. So yeah, we're both Croc mad.
What's a routine in your day or a routine in your week that if I took it away from you, you'd have a mental breakdown?
I instantly knew what that was, because my heart just started pounding, thinking, don't do that. So for me, it's something I've probably spoken a lot about, but it's my audiobooks for Harry Potter. So read by Stephen Fry, because he has literally been a big part of my life, and he's been able to put me to sleep so many nights where I've had struggles to sleep, to the point where I can't listen to his voice anymore on TV, because it literally just, I'm gone. So I think if you said to me that I could no longer have the Harry Potter audiobooks, I think that's when things would go terribly wrong.
If I were to ask your 3 closest friends to describe you in one word, what's one word that I could get them all to agree upon?
Passionate, I think, would be one.
What's the phrase or lesson that you have heard from your mom or your dad or a family member most in your life that you still repeat to yourself because it inspires you?
This inspires me. I think to never give up, to never surrender. And it's something that I didn't realize was such a big thing, but even my son says it. And there's that one, but there's also one more thing that's always kind of kept me going, especially with work, is I can't believe I actually quoted this in my interview for my job that I'm working out in general practice. I didn't realize it was an interview at the time, but they said basically there's going to be times where you're going to be bored. And I said that's fine, because I have a saying, and it's pretty much it comes out from Mary Poppins with Julie Andrews, and it says, with every job that's got to be done, there's an element of fun. And if you find the fun, the job's a game. And it's very much, that's how I've seen it, especially when going through those dark times, especially with the jobs that we do. Like I said, there's moments of sadness and happiness and anger and frustration. But if you're able to kind of, like I said, to find that bit of fun, that happiness, to make it shine, that I think makes the job that day a little bit brighter and a little bit better. And I think that's the same attitude that I have towards life and towards my patients, really, especially when it comes to, like I said, to mental health and to that support. You know, there's going to be moments there where you think they just want to give up. But if you find that one sparkly bit, you've got to shine it so bright.
Martyn, before we start to wrap up this episode, is there anything that you would like to share with your audience about where this is going and your vision or the legacy that you want to leave that I haven't asked you about?
I think for me, it's getting to my legacy would be, I think that, because they always said that, how far do you want this to go? So the moment I can retire is the moment where I can randomly ask a patient or a person in the street what a nursing associate is, and they can instantly just blurb it out, you know, because I can say to them, what's a nurse? And they instantly go. They can say, what's a healthcare assistant? Yeah, I know what that is. But so far it hasn't happened, but at one day it's going to happen, and I'm going to have to retire. Hopefully not too soon, but that's the legacy I want. I wanted to be able to think, yeah, that's it, I've done it. I've reached that point where we're accepted and I've made a difference within the healthcare system.
But that is a perfect mic drop. Ladies and gentlemen, thank you for listening in and helping me discover what's so special about one of your favorite podcast hosts from across the pond. My name is Peter Murphy Lewis. Don't forget to subscribe to this channel, share it with a friend, give it a like, give it a review. This is Just a Sharp Scratch. Signing off, Martyn Davey and Peter Murphy Lewis. Thank you so much, Martyn.
Thank you, Peter.